Hi, welcome back. Today I'd like to talk about ADHD, which means Attention Deficit Hyperactivity Disorder, which happens mainly in children. It is a neurodevelopmental problem, which can also be accompanied by oppositional defiant disorder and also conduct disorder. So I want us to try and figure out how do I deal, or how do you as a parent deal with a child who is manifesting symptoms of oppositional defiant disorder, and you have tried disciplining them, things are not changing, they are testing your patient, and you really cannot understand what is happening. So I want us to look at 8 discipline rules in which you can use with your child to see how well you can assist them. So number 1, you need to treat before you punish, and never discipline a child for behaviors that are symptoms of ADHD, because there are things that are happening even without their control. And oppositional deviant disorder and that aspect of them testing authority sometimes are neurological, and they happen without the control of the child. Number 2, exercise away hostility. Daily physical exercise for ADHD is a potent tonic for the brain, and it promotes healthy brain functions and helps the child control aggression. So ensure you have exercises that can take away that hostility. Number 3, know your child's pattern. Note when and where your child anger flares, and documenting those episodes or rather those triggers that cause your child to be flared up, helps you to keep track of their aggression. Number 4, be clear about rules and consequences. Remember, when a child knows that if I do this, this is going to happen, that will help them, or rather it will help minimize the episodes of deviance, and explain what behavior is expected and exactly what consequences your child will face for breaking the rules. Then consistently enforce this. At times, as parents, or rather as caregivers, you discipline today and tomorrow you forget to be consistent. So being consistent is key. Also, stay cool and under control. There are days you will find that the child has misbehaved and you may easily lose your temper. Instead of overreacting and teaching your child to fear mom or dad, breathe deep and be a model as to how they should behave, or rather how one should behave when you are upset. And number 6, use code words. When your child is annoyed, you can create a code word between the two of you, and you can say it. Maybe if I'm annoyed, I can mention lollipop, and I'm like, Mom, anytime you hear me mentioning lollipop, know that I'm worked up and I need a break, or rather I need something that is going to cool me off. So create a code word in which the two of you can know when one is annoyed. Also, you need to stay positive and boost your child's self-esteem by affirming the good actions, because remember, oppositional deviant disorder results to the child always being on the wrong side, but also work on praising the good efforts, or rather the good deeds, whenever they are done, because this is going to help boost their self-esteem. And this is a condition that may not be treated by medication per se, but behavior therapy is really important. And that brings the 8th discipline point, whereby seeking professional help is key, whereby you as a family may feel like now we have reached our climax, we are not understanding our child anymore, let's work with a therapist, because the therapist is also going to employ behavior therapy techniques to help your child. So I hope to enlighten you more about ADHD, which is one of the childhood disorders that manifest even below the age of 10. And stay tuned for more of this. So this was Tabitha Susan, a counseling psychologist. Remember to like, share, and subscribe.